Hey, it's Dr. Sarah Lawler. I specialize in treating individuals with chronic pain issues. And today I want to talk about different types of pain. And now there's a few types of pain. I just want to go over them because when you are experiencing chronic pain issues, it's kind of good to know what kind of pain that you are experiencing. So the first type of pain is the pain that we are most familiar with. It's called nociceptive pain, which is it's basically tissue damage. There's an injury, and the injury is the cause of your pain. So that's real simple. Like you had a fall, you fractured a hip, you got hit with a baseball, there's bruising, there's an injury and there's pain. So that's nociceptive pain. Now, there's also nerve damage, which is called neuropathic pain. So that's your peripheral nervous system, meaning the nerves that go through your body. Those can be damaged and cause you pain. Some examples and some causes of this could be like neuropathy, and that can happen for a number of reasons. It can be like an illness that you have. It can be a hormonal issue. They could be chemical exposure, but you could also have nerve damage from an injury as well. So that's where it can kind of get convoluted. Our bodies are complicated, so you're allowed more than one type of pain. But so you can have nerve damage for a number of reasons, and depending on whether the pain is on one side versus both sides might also depend on what causes it. So the other one which I really want to talk to you about is called nociplastic pain, which is actually an alteration in the way your brain processes pain. So it could also be an issue in the spinal cord, but your central nervous system changes the way that you process information, and you become more sensitive to certain things. I don't want to always speculate of why this happens, but I do find that individuals who have chronic pain at a certain point, their body, they will become nociplastic pain instead of the other two, which are a little bit easier to treat. So, there's a few reasons why I think this happens. I'm going to give you one example. It's just an example. I'm not saying this happens with every person that has nociplastic pain. But let's say that you live in a chronically traumatic environment, whether it's, I don't want to speculate, but let's say it's very stressful and it's just a bad situation, and you live in it day in, day out, years, months and years. Your body will you kind of get put in a fight or flight mode, and one of the alarm systems of your body is pain. So if there's something wrong, and your body will give you pain as a signal to say, hey, I don't like this. Something's going on I don't like. So what happens is your body doesn't, like your brain and your body are just in a hyper aware, hyper vigilant state. And you become your pain processing system with your central nervous system is extremely sensitive. So you will experience pain even if we can't find a cause, and even if we can't find a reason. And usually this nociplastic pain is not due to like a traumatic brain injury. This is usually due to something that's gone on for a while. But I also don't want to pigeonhole myself and say that it can't happen with a traumatic brain injury. I just am saying it's usually this chronic stuff that's going on. So I hope that these explanations help and kind of open up your mind about pain and about pain science. There's different types of pain. And treating them can be different for every single person. So we need a team, we need a village, and I hope you're having a wonderful day. Please let me know if you have any questions about what we just talked about or further questions. Thanks.